All right, well, good evening, everyone, and welcome to the annual general meeting of Health PEI. I'm Jennifer Evans. I'm a member of the Board of Directors for Health PEI and Director of Operations for Stingray, Prince Edward Island, and New Brunswick. I'd like to begin by acknowledging that the land we gather on is the ancestral land of the Mi'kmaq, and we respect the Mi'kmaq as the Indigenous people of PEI. As a Crown Corporation, it is important that we take a moment in this setting to reflect on the history of the Indigenous people here and across Canada. I will be your Masters of Ceremonies for tonight's Health PEI Annual General Meeting, and we are pleased to host this annual public event where we recognize the work Health PEI staff have done to support our healthcare system across Prince Edward Island. It's also an important venue for you, the public, to learn more about Health PEI and ask questions about the operations of our health system. In addition to the many people in the room with us tonight, we are pleased to be hosting this event live online from Charlottetown. The event is being broadcast live, and this meeting is being taped and will be available for future viewing on the Health PEI website. So welcome to our friends and colleagues joining us from home throughout the province. We are also pleased to have translation services available this evening, so for those of you in the audience who wish to listen to the proceedings in French. Additionally, Elise Arsenault, French language services analyst from Health PEI, will translate questions from French to English on behalf of those who wish to ask questions and receive answers in French. Our meeting tonight will focus on reports covering the fiscal year 2023-2024. Tonight, we will hear from a number of people, including the Honourable Minister of Health and Wellness, the Health PEI Board Chair, the Community Health Engagement Committee Western Chair, our CEO, the Chair of the Quality and Safety Committee to announce the winners of the 2024 Leadership Awards, and our Controller of Health PEI. Following these presentations, we will have a short question and answer period to respond to any questions you may have regarding the reports presented tonight. So to begin, I will introduce the current Health PEI Board of Directors. I would ask that you please stand as your name is called. Our Health PEI Board Chair and Board Member, Diane Griffin. Board Member and Chair of the Community Health Engagement Committee Western Region, Colleen Parker. Board Member and Chair of the Community Health Engagement Committee Eastern Region, Ryan Foy. Board Member Megan Chevery. Board Member Uma Kunia. Board Member Peter McDonald. Board Member Dr. William Montopar. Board Member Mona O'Shea. Board Member Matthew Vaughn. And Board Member Dr. Richard Wedge. I don't think Dr. Wedge is with us this evening. We'd also like to recognize Helen Flynn, who has retired from the board this past year. Thank you, Helen, for all your service. Thank you to all of our board members, and a special thank you to the members of the public, patients and clients, and of course, our staff who've taken time to be with us this evening. At this time, I would like to invite the Honourable Mark McLean, Minister of Health and Wellness, to provide opening remarks. Minister.
Thank you, Jennifer. So it's truly a pleasure to join you all here at Health PEI's annual general meeting. So welcome to everyone and those that are coming in just now and those that are joining us online. So my thanks to the organizers for creating a space where Islanders from tip to tip can come together and strengthen our collective vision for healthcare in Prince Edward Island. So as we know, healthcare is one of the most critical issues for Islanders. So before I go any further, I'd like to acknowledge Diane Griffin, Chair of the Health PEI Board, and each member of our Board of Directors, as well as Melanie Fraser, our CEO, and the entire Health PEI leadership team. Thank you for all your leadership and dedication to healthcare on PEI. Every day, thousands of Islanders engage with our healthcare system, whether visiting a clinic, a medical home, or an emergency department, receiving home care, or supporting loved ones in hospital or long-term care. Healthcare is woven into our daily lives, and every Islander has a stake in our system. These past 8 months, with Mel's guidance, have been a period of transition. I want to thank each of you for your steadfast leadership and unwavering commitment to providing the best care for Islanders. With a team of over 4,400 healthcare professionals whose compassion and skills are essential to delivering patient-centered care, I am confident that our system will continue to grow and thrive. Tonight, we'll hear about the work our health professionals have been doing, and we'll have the chance to discuss ways to continue involving our healthcare system. The landscape of healthcare is always shifting with new technologies, research, challenges, and opportunities, but the desire to provide high-quality care remains consistent. To achieve this, we need to ensure that all of our resources, from our health professionals to our facilities, equipment, processes, and policies, are optimized and working to their fullest potential. Above all, we must remember that healthcare is about people, the patients, the services, and the care that they need. It's about Islanders and meeting their healthcare needs. Tonight's meeting gives Islanders a chance to share their perspectives and contribute to the future of healthcare in our province. This isn't a new effort. Since I became minister, we've been working diligently to make progress and move the dial in healthcare delivery. And this past year has brought significant advancements. As you all know, we signed a historic physician services agreement, putting a special focus on family medicine and positioning our family doctor compensation among the highest in Canada. This agreement raised compensation for nearly all specialties above national average. We also streamlined the billing program, reducing fee codes for physicians from approximately 450 to about 30. This change allows doctors to focus on patient care and less on paperwork. Our patient medical home model continues to expand with 17 operational sites, three more in development. This collaborative care approach is in enhancing healthcare delivery, and we expect it will help reduce our patient registry numbers and bring stability to the system. We've also made changes to bring registered psychiatric nurses into our system and regulatory changes to allow RNs and RPNs with advanced education the ability to prescribe medications. We continue to expand the Pharmacy Plus program, which in turn eases the burden on emergency rooms and primary care providers. We've accelerated the integration of international trained nurses, welcoming them to our healthcare team within weeks instead of years. We're adding associate physician and physician assistants to support our current staff and provide training opportunities for our new professionals. We're excited that 4 of these positions will start in the coming days and will make a significant contribution to care on Prince Edward Island. We also introduced the Marion Reed Bursary to support Island students training off Island for healthcare careers with return and service agreements to encourage them to bring their skills back home. I also like this program as it allows us to do workforce planning with regards to who's participating in this program. So as we all know, it is a transformative time for healthcare, and it comes with its share of challenges. But with these challenges, there are new opportunities. We now need to innovate and adopt new solutions. No matter our role in the healthcare system, we share a common goal: to improve healthcare for every Islander. Healthcare just isn't a priority. It impacts each of us every single day. So tonight is about bringing Islanders into this important conversation, and I look forward to meaningful dialogue with all of you, and thank you for having me here tonight. Thank you.
Thank you, Minister. At this time, we would please welcome our board chair of the Health PEI Board, Diane Griffin.
Good evening, everybody. It's great to, whoops. I should.
Someone shorter than me.
It happens. Good evening, everybody. And thank you for all being here this evening, and for those who are watching online who have taken the time to join us as we review the past year. Just as importantly, we're going to look at ways we're changing the system for the better as we move forward. Thank you, Minister, for this is our second year as an annual general meeting attendee together here, so it's excellent to be here with you. Your commitment and leadership are greatly appreciated. And I'd also like to acknowledge your Deputy Minister, Lisa Thibault, who's also been a steadfast partner in healthcare, and we've all worked together to try and make progress happen. Lisa brings insight and leadership to healthcare, and with her team at the Department of Health and Wellness, she works collaboratively to provide the policy direction and support so that Health PEI can implement care in the best ways possible. So they're quite a team, this minister and this deputy. By the way, as you all know, teamwork, great teamwork makes everything possible. And you, in this audience, are part of that team, all of you. So I'm excited that for the first time in several years, we have a formal link to the public through the reestablishment of our community health engagement committees, CHEC for short. We refer to them as CHEC all the time, so it takes me a while to think of the full name. The co-chairs have been introduced earlier, and that's fabulous. And Colleen Parker will follow shortly with a report on the work they've been doing. So now that the pandemic is, or the worst of it, is behind us, it's great to have this committee up and running again, because that input of Islanders is really important, not only for the board, but for the department and for the staff that are working in the system. So we all appreciate their inputs. And of course, this gives me a great opportunity to welcome our Chief Executive Officer, Melanie Fraser. She'll be speaking to you shortly. It's her first annual general meeting for this particular event. And also, she's new to Health PEI, so it's great to have her. We're so fortunate to have her with us. She joined us about mid-March or early March, just before the end of the last fiscal year. And she came on board very quickly and has made immediate progress on our most critical files. So I'm very pleased about that. She's had to step up to some significant challenges with innovative approaches and a strong focus on team building, accountability, and transparency. We really like that approach. And I also want to thank Corinne Roswell. She's here tonight. She graciously took on the role of interim CEO from January until Melanie arrived in early March. Corinne, she's our Chief Operating Officer. She took on the role with great professionalism, empathy, and with patience at the center of every decision. Last year, I spoke about the challenges in healthcare, and of course, there are many. They're still with us. Our lack of healthcare staff in Canada is felt here on Prince Edward Island, as it is elsewhere, of course. But because of our small size, often if somebody is retiring or becomes ill and has to leave, all of a sudden our service is in a very vulnerable status and even subject to closure in some services, which is very appalling to all of us. Our teams need support, and we need to continue recruiting for the front lines and for those staff who support the frontline staff. However, we're turning a corner, and it starts with having a clear focus on what needs to change. So Melanie and her team are homed in on the first priorities, including enhancing recruitment into the entire system, building primary care teams, and preparing to support the UPEI Medical School. And we have the Dean with us here this evening and other staff. I'm very pleased. For the past several months, Health PEI teams and external partners have worked hard to define the path to get us from where we are today to where we need to be. And I don't want to steal Mel's thunder, but I'm confident in the work that is happening to improve on all these priorities, and I'll leave her to address more of that as she comes on stream here in a moment. And our Health PEI teams are doing it with the urgency, planning, and ability needed to see positive changes. I mean, we're so fortunate we've got the staff that we have. Last year when I spoke at this meeting, which was held in Summerside, we had 10 patient medical homes. These are the teams that care for more people than ever before in supportive, sustainable, collaborative settings. And the ministers announced we're up to 17 with some more coming online shortly. Best of all, we now have a clear system to start new homes from the idea phase through to becoming reality and to seeing new patients. And key to growing our patient medical homes model is the recruitment of care providers. A building without staff doesn't account for very much. With the competitive collective bargaining agreements signed with staff across the system, including the recent physician services agreement that ranks us among the top in the country, we have a better opportunity now than ever to bring in the right team members to improve access to care. Another example of progress, our midwifery program has taken off, helping to provide services to mothers and families and delivering babies for the first time here as a regulated profession. We are making the way forward, as challenging as things may be, but I am inspired by the board that I work with, great folks, all of them, by the healthcare Prince Edward Island staff, and the leaders who all embrace these challenges optimistically. The progress we've made and will make is only possible with the investment from the provinces and the support of the provincial government. As a health authority and as stewards of public funds, we owe it to every islander to be sure that every dollar is properly used and reported for. And when things are not managed properly, we must correct course. And in the days ahead, I understand there will be an audit or audits released by the Auditor General's office that show we've had some issues. And while I can't speak to those before they are released, I want you to know that I fully trust the CEO and the members of her leadership team to have the right measures in place to ensure our fiscal accountability. Finally, I want to thank the board for their intense dedication to the oversight and governance of Health PEI. They're all here in the front row. Unlike church, where people like to go to the back, they're in the front row. Great team, love working with them. In addition to those who are currently on the board and who were introduced by our MC earlier tonight, I'd like to thank Helen Flynn, who's here. She's had many years on the board and has retired this year, and I've always been grateful to her for her input as a board member, but she's not quite rid of us yet. We are keeping her on our Quality and Safety Committee, which has been her passion for many years, so it was a delight that she agreed to do this. Thank you, Helen. And thank you again to all staff who ensure that our health system continues providing excellent care to islanders. The system depends on your efforts, and your board deeply appreciates and supports you. Thank you, everybody.
Thank you, Diane, Board Chair of the Health PEI Board. As Diane mentioned, we are certainly delighted that we have reactivated our Community Health Engagement Committee. And with us now, we would like to welcome board member and our Western Czech co-chair, Colleen Parker.
I think Diane and I are about the same. Good evening. My name is Colleen Parker, and I live in the Alberton area. As well as serving on the Health PEI Board of Directors, as mentioned, I'm here as the co-chair of the Western arm of the Community Health Engagement Committee, as we refer to as CHEC. CHEC committees were reinstated in April of this year after a 4-year hiatus due to the COVID pandemic. My co-chair, Ryan Foy, is also here tonight. He was sitting right beside me, and we enjoy working together. The two committees, East and West, represent regional communities, cultural groups, and hospital foundations from across the island. Before reforming, it was agreed that the two committees would meet as a group either in person or virtually on a quarterly basis. Each of our members bring their own set of skills and expertise to the committee, not limited to healthcare. Our 18 members are committed to their duties, which are to gather and consider information from the public respecting the health needs and services available, to identify health-related issues in each region, to provide feedback related to both health policy and the delivery of health services to the minister and board of directors. And finally, to provide input regarding strategic planning prepared and submitted by Health PEI, the Department of Health and Wellness, and other provincial strategies relating to healthcare. These are early days for most of our members. So far, we have had presentations on initiatives regarding wellness promotion and Mi'kmaq Navigator support services across the island. Ryan and I have had the opportunity to present about CHEC at the Leadership Forum. We look forward to providing feedback to the minister and the board to highlight the direction of a stronger health system now and in the future. We are excited for our collective voices to be heard, both as support to Health PEI and the department, but also as healthcare advocates for our communities. Thank you for the opportunity to provide this brief report on behalf of myself, Colleen Parker, and Ryan Foy. Thank you.
Thank you, Colleen. Both of those CHEC committees are such an important outreach for our board, so we really appreciate all your efforts. At this point in our agenda, we are going to acknowledge our long-term service awards, and to present those awards this evening, please welcome our new CEO, Ms. Melanie Fraser.
I'm a little on the taller side. Good evening, everyone. Thank you. This is absolutely one of the highlights of our agenda this evening, to have the opportunity to honor the staff who have served for 4 decades within our healthcare system. We have a list of individuals who've worked through reorganizations, through pandemics, and really through immense changes in how healthcare has been delivered. Their dedication to service for Islanders has been exemplary, and we were so fortunate to have 4 long service honorees with us tonight, and then cold and flu season hit. And then we had 3, and then we had 2, and I'm hoping we still have 1. We do, wonderful. For each of these honorees, I am still going to take a moment to read out the biographies provided about each of them and their careers, and to share publicly the commitment that they've dedicated throughout the last 4 years to servicing the people of the island. So I'm first going to start with Marjorie Thompson. Does that make sense? Yeah, good. All right, so Marjorie Thompson. Marjorie has worked with Shores. Shores was formerly known as the Women's Wellness Program and Sexual Health Services. It was located at the PCH, at the Health Information Professional, since the program's inception in 2017. In addition to serving as the chief statistician, Marjorie is often the first person that people hear when they call Shores. She's known to have a very calm, patient, and professional demeanor, and she reassures patients when they're feeling vulnerable, overwhelmed, and frankly, sometimes scared. She's known to frequently go above and beyond the role and responsibilities associated with that position. She's always ready, willing, and able to do what is needed to provide quality patient and family-centered care. Marjorie gives selflessly, both professionally and personally, and is a caring and devoted mother, daughter, sister, friend, and community member. The Shores team is eternally grateful for her contributions to their program, and they feel very lucky to call Marjorie their colleague and their friend. Is Marjorie here with us this evening? She is, wonderful. So Marjorie, we'd like to welcome you to accept this award in recognition of your long service. So I'm going to read out the other three long service recognition awards, and it's unfortunate that these individuals couldn't be with us tonight, but we really do want to shine a light on their careers. So the next individual I want to speak to you about is Carol Walker. Carol began her career on the medical floor of Prince County Hospital in 1975 before she moved on to pediatrics. After a brief move to Halifax to work at the IWK, she returned to the island, thankful for us, and began working in the emergency department at PCH. Carol is known to truly love the fast pace and unpredictability of the emergency department. But after that, her next adventure was as an educator for the medical and surgery floor. And while there, she helped to build and implement the CIS, which is an electronic charting system. She then officially took on the position of Clinical Informations Lead in 2012 and has been working on implementing more solutions in the acute care setting. Carol has seen the role as a great opportunity to meet new people. All new staff nurses, physicians, and allied health professionals need to have CIS training before they start working in the system, and she enjoys meeting with them and helping them learn the ropes. Carol is also proud mother to Luke, Rebecca, Hannah, Victoria, and Michaela, and I love this part. She is the mom to her fur babies, Marley and Georgina, and in her spare time, she loves working on agility with her dogs. She also teaches classes for the love of dog. Carol loves Holman's ice cream, and she is a dedicated community volunteer at many events, including the Canada Games and Another Way of Learning Center. So while she's not here, please join me, though, in a round of applause for her and her dedication. Thank you, Carol, and we will be following up with you to get you that award. Our next recipient is Myrtle McCormick. So Myrtle started as a receptionist at the front desk of the Old Surrey Hospital. This was in the days the days of having a ward clerk and admitting staff. Myrtle was known to always be willing to pick up casual shifts at the front desk or as a ward clerk or the health clinic whenever she was needed. She has been a continuous, dedicated, and committed employee to patients, staff, and the hospital for 40 years. Her positive attitude and beautiful smile are evident at all times. Myrtle has worked in many areas of the hospital over the past 40 years, including in admitting, in the lab and diagnostic imaging areas, as an administrative support for the health center, and currently as an inpatient ward clerk. It is a long-standing joke that she could run the hospital because she was so familiar with all the different departments. Myrtle is often the first person you encounter when you enter the inpatient unit or call up on the telephone, and she's always pleasant and willing to help whenever she can assist. There is no task too big or too small when you ask Myrtle to assist. She is always enthusiastic and willing to do what is needed to support the team on the inpatient unit, and she loves to participate in social functions with staff. Myrtle's an avid walker and apparently makes the best microwave popcorn. So again, our tremendous thanks, Myrtle, to your dedication, to your community, and to the patients at the Old Surrey Hospital and beyond. And thank you again for your commitment, and please join me in a round of applause. There's honestly nothing better than when your colleagues and coworkers write these wonderful things about you, and I hope your family feels so proud of you, all of you tonight. Our last recipient is Mr. Paul Hughes. Mr. Paul Hughes started out as the handyman at the QEH on January 31st, 1982, and proved himself to be a very hard worker who loved to find new ways to do things. Back in the 80s, he received numerous letters of recommendation for excellent attendance, rarely missing a day each year. On April 17th, 1987, following a rigorous competition, Paul was awarded a permanent job as an OT technician, and even I had to figure out what that was. So an occupational therapy technician. So this was a fairly new role, and Paul remains Health PEI's only occupational therapy technician to this day. So Paul has developed the OT technician role into something indispensable in the rehab world. He's helped countless individuals and families as well as other clinicians. He can find a creative solution to any physical problems. While Paul isn't an occupational therapist, he did receive a citation award from the Canadian Association of Occupational Therapists in conjunction with the PEI OT Society in 2012 to acknowledge his contribution to the health and well-being of islanders. In 2015, the then PEI Council for the Disabled, now known as the Resource Abilities, also recognized Paul for his contribution to the creation of, oh, I'm going to get this wrong, the Snoozalin Room. Snoozalin Room. I knew I was going to say it wrong. Paul was presented with a QEH Excellence in Service Award in 2019, and the pediatric therapy staff have recommended him for this award based in part on the tremendous feedback they received from the daughter of an elderly seating client. Without exception, Paul cares for people of all ages with dignity and respect, and his colleagues feel fortunate to work alongside him every day. Please join me in congratulating Paul on his 40 years of service and for his incredible contributions to the island. Again, Paul, we hope your family are at home watching and as proud of you as we are. So thank you to each of you for your incredible service to islanders and the healthcare system. I also want to thank the hundreds of staff who have served decades with us. It was really hard to only recognize the 4 individuals with 40 years of long service, because if we brought up the individuals with 35 and 30 years of long service, we probably would have been here till Sunday. There will be recognition for all of those who are reaching milestone years this year in each of their home departments. But we recognize you tonight. Your commitment to healthcare is such a vital part of everything we do, and we thank you. Congratulations.
Thank you, Melanie. Such important career milestones for us to recognize tonight. Also this evening, we have 2 videos that we are going to share with you. Our first video highlights the Somerset Manor. Now, we share this video to showcase the amazing work being done at the Somerset Manor in Summerside to improve the lives of both residents and staff. Somerset Manor is an 82-bed combined long-term care facility in Summerside. There are 6 neighborhoods, each with 13 or 14 residents. This includes a bilingual neighborhood that has 26 beds and a dementia neighborhood that has 28 beds. In the video, you will hear from Gail Lamont, administrator for the Manor, Tabitha Gallant, the therapeutic dementia worker, and resident Richard Birch, who sadly passed away just a few short weeks after this video was recorded. Let's have a look at the great work being done at Somerset Manor.
So Somerset Manor is a manor that was in Summerside for a few decades actually, but in 2013 we moved into this brand new home. And at that time that we moved in, there was a new philosophy or a new approach toward long-term care residential services. And what that was about was creating a different atmosphere, a whole different philosophy of long-term care. It is about building a facility that was more like a home environment versus an institution. In Somerset, we have 28 dedicated dementia care beds in English and 13 dedicated bilingual dementia beds. So we do have a real focus on dementia care. We also support the bariatric population in this catchment area as well. So we have some specialized supports that we give to these populations, whether it's dementia, bilingual, bariatric, and then there's some other interesting and complex kind of care needs that might be best met at the Summerside home. So we recognize there's an opportunity to create spaces throughout our manor that reflected things that the residents would recognize and enjoy visiting, not just being on their household in the household model. So we wanted to expand beyond that and create a bigger community. And they're looking for something recognizable, something that brings them comfort so they feel that they're in a place that they're happy again, or that feels familiar?
A therapeutic dementia worker is a relatively new created role with the intentions of reduction in behavioral processes within our dementia populations by using therapeutic intervention first. So calming techniques, making sure our spaces and our environments, such as all of these lovely decals, have purpose and point. It's really getting to know that resident right in and out, so I know what I can offer to that person when they feel distressed. Is it as simple as a cup of tea, or do we have to use one of our specialized therapies that we've developed here, whether it's our snoozlin room, aromatherapy, virtual reality, or even going through our main street and seeing what's going on at the hair shop and checking out the gas station and doing all of those types of lifestyle things that help them identify with something that they know.
The staff is great. I have a fellow there. She done everything. She's my leader. I follow her. Couldn't ask for a better spot. Makes me feel like I'm happy. I can't describe it. You know what we have here? All the pictures, the tree with the apples, and just everything is amazing. I'm happy as can be.
When you come in the building, I know the immediate response is when everyone sees the decals throughout the facility, I think it just brings a smile to your face because it's very evident that I'm in a downtown area, or it's very evident I'm in a park. So the staff are often commenting about they're enjoying going through these spaces, but it certainly makes them appreciate and recognize that it really is offering the residents a lot more quality of life. And knowing that this is something that's created by our staff with our residents and family so that everyone actually has a better place to work and live when they come to work at Somerset Manor.
Some very innovative and creative work being done at Somerset Manor. Well done, and it was a very special treat to get to a little snapshot of that tonight. So now at this point, we are going to hear more from our new CEO. We welcome back Melanie Fraser for her CEO report.
Thank you, and I love that I'm still the new CEO. I was switching to new-ish for a full year. That's the terms and conditions. So thank you for having me tonight. I want you to know that I'm approaching both this job and tonight, my first AGM, with some humility. I've certainly learned a lot in my first 7 months on the job, but also recognize that I have a lot of listening and a lot of learning still to go, and I'm looking forward to that. Just as I was sitting up here, I was reflecting on how many of you I actually know in the audience, and that feels pretty good, being 7 months in, to know that we've had, many of us, an opportunity to talk about the challenges in healthcare and really to build what I see as the trust, the relationship, and the team. To Diane's point earlier, this is a team sport, healthcare, and it's been great to begin to build that team with you. It was also wonderful to watch this video. I spent a bit of time at the Summerside Manor, and I do know a gentleman whose wife receives amazing care in that dementia unit, and the staff that deliver that care each and every day. Man, they're a special bunch, so congratulations to all of you. It was lovely to be able to showcase your work. It really is incredible, the things that we can accomplish. So 7 months in, this is my CEO report to you and to the public. So thank you to everyone for your interest and commitment to healthcare in the province. I'd like to start by thanking our board chair, Diane Griffin, both for your insightful remarks, but for your leadership and your guidance to date. And I'd also like to thank our wonderful board of directors. We are so fortunate to have such a strong, dedicated, and diverse board supporting the work that we do. So thank you to each and every one of you. You know I appreciate you. I also want to echo our chair's comments and thank Minister McLean for his leadership and dedication to help us improve healthcare. His support has been unwavering, and that's so incredibly important in my role at the Health Authority. And I'd also like to echo Diane's comments about the Deputy Minister of Health and Wellness, Lisa Thibeault. Lisa and I spend, I think, almost every day attached at the hip, collaborating on the challenges and the opportunities of healthcare. It's a daily event. She is insightful. She's extremely engaged. She's been an absolute partner in the work, and I'm so grateful to have you as our partner as we try to make progress in healthcare. I'd also like to thank my leadership team. They have worked tirelessly to help us tackle the everyday complexities of healthcare. They guide, mentor, and lead complex issues and big teams through change. Thank you to Corinne for being a wonderful supporter as I stepped into this role. Thank you to the whole team for helping me transition. I know it's a lot of work to onboard a new executive, so I appreciate it. I tried to be low maintenance, but I know some days it wasn't always low maintenance. But really, the kudos go to you. You show up every day. You work so hard for Islanders. I wish you could see behind the scenes what I get to see and appreciate every day. They're a small team, but man, they're a mighty team, and I'm so fortunate to have them. So thank you to each and every one of you. I also want to take a moment to recognize a man who's not here tonight, but maybe he's tuning in. That's Dr. Richard Wedge. He stepped out of retirement and stepped back from the board to be our acting chief medical officer while a search is underway for a new CMO. His knowledge and his experience are just amazing assets to our healthcare system. I know they've been amazing assets to our board, but his willingness to jump in and help me out here. This is an individual who throughout his career has gone selflessly to bat for PEI and for healthcare and PEI time and time again. And his sense of service above self is just an example to all of us of what can be accomplished when you focus a career and a lifetime around service. So I really wanted to recognize him and thank him for that. And I also want to say thanks to my dad, who came out to see me in my first AGM tonight. So don't be too rough on me. So thank you. So I started the CEO just as 2023-2024 came to a close. Usually at an AGM, we use this time to look back and look at everything that we've accomplished. For me, that'll be a little more challenging because I wasn't here, but I also do think it's the time to look forward. It really is a time to think and act and tackle our challenges head on and try to build momentum in doing that. And to do that, we must look to the people that we serve and understand your needs and your wants. And as much as my team and I wake up every day thinking about the healthcare system and working in the health authority, we remind ourselves every day that we cannot lose sight of the fact that it's your healthcare system, it's your health. It belongs to the people of Prince Edward Island. We have the privilege of delivering those services, but they're on your behalf, and our goals need to match those areas of improvement and those services that we hear about from you. And you've told us pretty clearly, you want more access to healthcare services. You want a primary care team so you can have a home base for care close to where you live. You want emergency departments where you can be treated when needed, and hospitals with the appropriate space to care for you and your loved ones. You want access to the care that you deserve, and you want engagement. You want transparency, and you want accountability from your health system leaders. Delivering on that is our urgent mission and our commitment. I can tell you that our team has taken that mission on with determination. And over the past few months, we've taken decisive action to address our priorities in the health system's challenges. And these aren't our priorities, these are your priorities. To be clear, this work, the issues, the challenges in healthcare have never been about our teams lacking the skill, the expertise, or the dedication. Our teams have that in abundance, and I am so grateful and inspired truly by the incredible staff. You only need to watch, these videos or go out to visit any of our healthcare facilities to see the incredible work that's happening here in PEI. And our system owes these hardworking teams more support to help them plan and grow services to meet the increasing demands and meet your requirements for access to healthcare. So that's why one of the first things that we did back in June was we launched a transformation office. Now that's just a big fancy word for basically support for teams, for dedicated resources to support the work that needs to happen across Health PEI with all of our healthcare partners. This transformation team, they add to the planning and the project management muscle that the system needs. They allow our physicians, our nurses, our healthcare staff and teams to focus on delivering healthcare. The office was implemented and supported by outside experts. We hire people to help us both deliver capacity and build capacity at the same time because we want to develop momentum and we want to generate progress. The analogy that I've often used when talking to people about the work that we're doing here is like an airport. So if you liken healthcare workers to pilots or flight staff, they need to be able to focus on flying the plane, expecting healthcare workers and the teams that work alongside them to manage and plan a system while delivering healthcare is like asking your pilot to do air traffic control, to clear the runway, to check baggage, all while safely landing the plane. What we're trying to do is build the capacity and support to do that planning, to do the advancement, to move the system forward, while at the same time our healthcare providers can work on providing care. And the two need to happen hand in hand, right? We need to listen to the folks flying the plane. We need to listen to our flight staff. They tell us what they need, but we have to be the resources that help deliver the solutions that they need so they can do their job better. This shift to supported teams doing focused work has really energized our work and led to quick progress in a number of priority areas. And we are very much focused on priorities and building the foundation for other priority work that will come very shortly. With this added support, with these teams, we've been able to make significant strides in 4 particular priority areas since June. Namely, those are improving our recruitment and retention, expanding our patient medical homes, modernizing our patient registry, and partnering with the University of Prince Edward Island to implement the medical school. This work is all about access. We're getting better at hiring, and we're going to hire more staff. We're getting more primary care providers and teams stood up in patient medical homes. Sorry, I dropped my pen there. We need to know who's waiting for a provider and connect them to it. And we need to get an ongoing pipeline of talent through the medical school and creating a learning health system. With the support of the transformation team and all of the staff working the front lines, we have a new energy at Health PEI and a tangible opportunity to make real progress and move from where we are today to a truly world-class system. We have many advantages in PEI. It's why I came here. The advantages we have are clear, but we probably don't spell them out often enough. So I thought I would tell you how I see them. We have incredible alignment of our government, our board, and the Health PEI team to make meaningful change. You cannot underestimate the power of alignment and what progress you can make when you're aligned on things that can happen. This isn't the case in every system, and we are very fortunate to have it. We have wonderfully engaged labor partners that we can meet with, talk to, scrabble with a little, But we come to the room with each other, we talk to each other, and it's partnerships and relationships that are unique to PEI and are not what we see in other jurisdictions. And so we are fortunate to have them, and we are grateful for them. We have one health system across the entire island. As difficult as our issues can be, they are not multiplied by having multiple agencies and silos that we have to bust through to get to progress. We've already got that foundational piece in place, and that is truly an asset for all islanders, and particularly for our healthcare system. And we can accelerate excellence across our system very quickly. We're big enough to develop excellent solutions, and we're small enough to spread them fast. And that's exactly what I've seen, like with these dementia care units, like innovations in the field, like our critical care transport team. There are folks in the field that are developing innovations in real time, and then we're building the muscle to be able to scale those and turn those into provincial programs. That is an asset. And we have incredibly engaged community members and staff. I have never seen anything like the likes of the community engagement here. I've had the opportunity to join many foundation events and community events, and the investment that the people of Prince Edward Island have in their healthcare system is a tremendous asset and one that we have to leverage. The benefits of that cannot be manufactured. We are grateful for it, and we will treat it with respect. As you heard tonight, we've restarted our community health engagement committees, our checks, and you can count on us to grow our interaction and our learning from our communities going forward as these checks are sort of rebirthed post-pandemic. And as we continue to make progress in improving access to healthcare and continue to face challenges and embrace opportunities, it is essential that we maintain a high level of transparency and accountability to the public. We believe that open communication, building trust, and ensuring our efforts align with the community needs are the only way forward. You will have seen with our transformation office and team, it's new work. We communicate about it regularly. We invite people to participate regularly. We update you on progress. We update you on next steps. That's how we intend to continue all of our work. If you want to be involved, you only have to say, "Can I come on in the tent?" It's a big tent. You're all welcome. We are committed to transparency about our progress. We're also committed to transparency about our challenges. As Diane mentioned in her opening remarks, in the coming days, you're going to hear about some ongoing work we've been engaged with the Auditor General. It is for the Auditor General to announce the findings of their work, but we will be fully available and commit to you to be transparent and accountable to you for all we do, both in response to that audit, but also in response to everything that we do each and every day. We welcome your feedback. We need your feedback, and we encourage you to share your experiences and your concerns with us. As we move forward, people often ask me, how do you identify the priorities? There's so many challenges in the system. How do you make decisions with so many competing demands and needs and perspectives? And I often speak inside to my team as well as to our stakeholders about something called the quintuple aim, another really fancy word for 5 simple principles that I hold in my head each day as I come into the office, and how we make decisions that are the right decisions and show our transparency and accountability for the healthcare system. So these 5 aims aren't just about building a better experience for individuals, but it's about building the best healthcare systems. We sometimes refer to them as a framework, and we apply it to our decision making. So I'm just going to say how I interpret these aims. There's lots of fancy words for them, but these are my commitments. 1, we're committed to improving patient experience. This includes patient satisfaction, comfort, and engagement in their care. We're committed to improving patient outcomes. Our focus must be on quality of care and health outcomes. The 3rd aim is efficiency. When the cost of healthcare continues to escalate and remains 50% of provincial budgets, we must deliver value for the dollars invested in our system. The fourth aim is improved provider well-being. We only needed a pandemic to see how fragile the system is without taking care of our providers. This means their mental and physical health of all of the people that work in the healthcare system. And finally, the fifth aim is health equity. We cannot have differences in health outcomes and access to care that come from social differences like education, income, or ethnic background. So it's incumbent upon us who create policy, who deliver healthcare, and who participate in healthcare to remember that we represent diverse individuals that come from diverse backgrounds and situations, and ensure that we're planning a system that serves all. So we commit to deliver and lead our system through these aims. Our future plans are ambitious, they're exciting, sometimes exhausting, but mostly exciting. We are building capacity to deliver on your priorities. Upon the foundation that we've built with our early priorities, our next steps are to immediately address challenges in our emergency department access, patient flow through our hospitals, diagnostic imaging wait times, and surgical wait times. We know these aren't acceptable as they are, and we are going to put focused effort and lean our talent and our resources in moving the needle in the right direction. These are essential areas of access and services, and they require focused attention. So while much work needs to be done, we're confident we are on the right path. We have the right team. I'm looking at my team. We have the right partners, and we can support and drive progress. I look forward to reporting back at this meeting next year. You won't call me new then, no. And finally, I just want to take a moment to express my sincerest gratitude to our dedicated healthcare professionals and staff for your unwavering commitment to a system and to provide exceptional care. Together, thanks to your dedication, we're making positive differences in the lives of Islanders, and we commit to do more to support you in delivering that care each and every day. Thank you.
Thank you, Melanie, for your very first CEO report at our annual meeting. I think as board members, I can speak on behalf of the board that we certainly recognize our good fortune at recruiting someone like Melanie to this position, someone who is a collaborative, transparent leader and also a very sincere leader. And we certainly got that message tonight in your report. So we thank you. Welcome to Prince Edward Island. I know it's a lot, but it's okay. You've got all of us working right alongside with you. Melanie referenced our transformation office, and we're going to get a little further detailed report from Megan Van Gaal, who is our director of the transformation office. Please welcome Megan.
Now to see where I line up on the mic. Yeah, it looks aligned. It's great. So good evening, everyone. I'm happy to be here tonight to share more information about the progress we've made on the Transformation Office over the summer and elaborate a little bit on what you've heard already this evening. So in our next slide, we will start by sharing what we did during phase one. And so during phase one, we focused on setting up our new team. This team had 6 priority projects that we were handed, and so we worked on establishing the plans for those projects. We hired 7 staff internally to lead through these projects. We also put some effort into our communications plan and creating a way to make sure we were communicating about the progress that's being made here across all of our work streams and within our organization, as Mel said, to be as transparent as possible with the work that's happening, and also to ensure that all those involved in the work understood the accountabilities that we were working towards. And then additionally, we created some dashboards. And so these dashboards are, you see a snapshot of them on the slide, are a way to look at our key data that we need to make our decisions every day in a very user-friendly way to refer to and read, and they're updated regularly so that we have that important information for our decisions. And as we move on to the next slide, I'm going to take you through a little snapshot of what happened in each of the 6 priority projects that we worked on over the summer. So the first one being our transformation office. And so we had to start by looking at the design of our office, who we are, how we're going to work together, how we're going to work across the organization. And so we did that along with clarifying our roles and responsibilities for those involved in the projects. We also had our initiative playbook. So this is what we are using to plan out our first 6 projects and what we're using to plan out any of the other projects going forward. So that was created. And we also then created a multiple very structured processes to track the progress on our projects and to keep everyone informed on the progress, share that around, and hold ourselves accountable. The second work stream that I'm going to highlight, actually we'll just go back one slide, it'll be on workforce recruitment. And so the team worked over the summer to simplify the recruitment processes for physicians, nurses, allied health professionals, and our support staff, including taking our physician hiring process from 49 steps down to 11. And they did that by working together as one team. We brought together the recruitment staff from the Department of Health and Wellness, from Health PEI, from the Public Service Commission to work as one unified team towards improving these processes, and it has worked really well. They've also worked closely together to integrate the information that they have, share it, meet on a very regular basis to update on new leads, new risks, new challenges, so that everybody is aware of the work and can action them together as a team. And then another deliverable they did over the summer was on the PMH recruitment plan. So this is the patient medical home recruitment plan to make a plan for how we're going to recruit all the resources that we need for the patient medical homes. So moving on to the next slide, I'll take us through 2 more of our work streams. So we had a project on the patient registry. And so the patient registry spent a lot of time looking at the information that's in our registry and looking that that information was accurate, that it was up to date and current, so that we could understand where the needs were for primary care across Prince Edward Island. And they also spent a lot of time designing, and now we're working on implementing that design for a more modern solution to manage all the information that's in the patient registry, including automating some of the data so that it stays accurate and it's ready for us to use to affiliate patients to primary care. And then our 4th work stream is the patient medical home work stream. And so they had 3 key deliverables that they produced over the summer. The first one being the operating model. And so this lays out what services can be expected in each home and to standardize the services from each home, from one to the other as much as possible. We also created a provincial plan. So this outlines where we are going to have expansion of our current patient medical homes or new patient medical homes. And then they created that playbook to help do the step-by-step on how we're going to build any of these new homes out in an efficient of way as possible. And so these 3, as you've heard already tonight from Mel, were really crucial to work together, both from recruitment, understanding the data in our patient registry, and understanding the capacity in our patient medical homes to work together to affiliate as many islanders to primary care. And then we have two more work streams on the next slide that I will highlight. And so as you heard Mel say, we did have a work stream that focused on the medical school. They work to increase the collaboration between Health PEI and UPEI as we are building out for our med school opening soon. They established a joint UPEI and Health PEI liaison committee. They held workshops with them to understand our shared goals and vision, and then created a plan that we will use to help us meet those shared goals and vision. And then the last work stream that we worked on over this summer was on organizational capacity. And this group worked to identify opportunities to have Health PEI become a more resilient and efficient and innovative healthcare team. They looked at what opportunities there were. They looked at other leading health authorities across the country to learn from them. That identified areas for improvement, and there are plans. They created plans to help us address those, which we're working through. And then on our last slide, this helps to summarize what Mel was saying at the end of her address. So we, over the summer, built on our foundation. We focused on some initial key priorities, and now we're moving into phase 2 to continue to build a resilient system. Of course, we need to continue with a lot of the work streams I just shared with you around primary care and our integrating with our med school, but we also need to work on improving access and flow into our acute care facilities through surgical and diagnostic wait times and the access and flow through the acute care facilities. So those are some of our priorities that we are going to be working on into phase 2. And with that, I really appreciate you taking some time to listen to our updates tonight, and we'll see you next year.
Thank you so much, Megan. When Megan presented her report to the board last week, I think all of us, we just couldn't believe that this transformation office has only been 12, 16 weeks. Like, it's amazing volume of work that has been done in such a short period of time. So we really congratulate you and your team. The fact that you've taken physician recruitment from 49 steps to 11 is something that's a stat we all really need to walk away with tonight, because that is very impressive work to be done in such a short period. So we can't wait to see what phase 2 delivers. That was only phase 1. At this time, we have more awards to present tonight. It is our 2024 Leadership Excellence in Quality and Safety Awards. To present those awards, we welcome Dr. William Montalpar, who is the Quality and Safety Committee Chair of our board.
Thank you, Jennifer, and good evening, everyone. Thanks for coming, Dad. I really appreciate it. I'm pleased to be here this evening to speak about the 2024 Health PEI Leadership Excellence and Quality Safety Awards and to announce this year's winners, especially given that this is happening during Patient Safety Week in Canada. Through its annual Leadership Excellence and Quality and Safety Award, the Health PEI Board acknowledges and celebrates staff who are making positive, sustainable changes across the healthcare system. The awards program recognizes individuals and healthcare teams that have led initiatives to improve the quality and safety of care in Prince Edward Island. Last year, the funds that were awarded in 2023, the healthcare team which received the awards used the money for 2 employee wellness conferences for members of the team to attend. So the award is well received, and it goes to good use and seems to continue through a good cycle. So now for the 2024 recipients. The Honorable Diane Griffin will be, our board chair, will be handing out the awards. And as your names are called, I ask that you step to the side of the stage to accept your award and gather at the back for a team photo to be taken once you are given your award. Thank you very much. This year there were 16 nominations for various initiatives across Health PEI, and this evening we will begin with the winner of the 2024 Health PEI Leadership Excellence in Quality and Safety Award. Excuse me, I should be wearing these glasses. Okay, so I just keep trying to fake it that I don't need them, but I need them. Yeah. So this award acknowledges individuals and teams who are making positive, sustainable changes across PEI's health system in the area of quality and safety. This year's winner was nominated by 2 independent nominators that each spoke very highly of the award recipient. The 2024 Leadership Excellence in Quality and Safety winner is Dr. Kathy McNally for her work on the development and implementation on the primary care roadmap. Unfortunately, Dr. McNally is out of the province and can't be with us this evening. However, when informed of winning the award, Dr. McNally was delighted to be recognized, and especially she wanted to acknowledge that she was part of a team, and it was a significant collaboration with the Department of Health and Wellness, and particularly Deborah Bradley. The initiative is the Provincial Primary Care Roadmap, or PCRM strategy, to overhaul and modernize primary care on PEI. The foundational principles of this strategy include team-based care, innovation, improved access, and integration, along with the coordination across the healthcare system. Under Dr. McNally's leadership, the team began their work in January of 2020 and released their report in 2021. As a result of their work, there have now been some 17 new patient medical homes, along with other initiatives to advance primary care in the province. The initiative is evidence-based and grounded in the broad and diverse feedback collected during the engagement strategy. As one of the nominators indicated, Dr. McNally has demonstrated a phenomenal work ethic and positivity throughout her roles as leads on this initiative, as well as in her role as the Chief Medical Officer for Health PEI. As a family physician and as a hospitalist, please join me in congratulating Dr. McNally on this very well-deserved award. Our next award is the first of the 2 Merit Awards. The Award of Merit acknowledges individuals and/or teams who are making positive, sustainable changes across Health PEI's healthcare system in the area of quality and safety. This year, the first Merit Award recipients are Dr. Michael Gersberger, a nephrologist, and Kendra Conrad, interventional nephrology registered nurse, both of whom are with the Provincial Renal Program, and the initiative is the development and implementation of the nephrology clinic. As noted by the nominator, by rolling out the interventional nephrology clinic for PEI, there was a reduction in wait times among patients, improved transitions and continuity of care, earlier diagnosis and treatment, reduced ICU and hospital admissions, improved patient outcomes, and improved patient and family experience, all of which are excellent measures of patient-reported outcomes and patient-reported experiences. Dr. Gersberger and Ms. Conrad's leadership demonstrated in implementing the development and implementation of the Interventional Nephrology Clinic is commendable. And on behalf of the Quality and Patient Safety Committee, we would like to acknowledge the key role you all played in the success of this initiative. The award is being presented to Dr. Michael Gersberger, lead nephrology in the Interventional Nephrology Clinic, Dr. Derek Chaudhry, medical advisor of the Provincial Renal Program, and Kendra Conrad, lead RN in the Interventional Clinic. Special thanks this year as well to the radiology group at QEH Diagnostic Imaging, especially Dr. Blagden, for all their help and support. So please join me on behalf of the Health PEI Board in congratulating Dr. Gersberger and Ms. Kendra Conrad on receiving an Award of Merit in Leadership Excellence, Quality and Safety. Thank you. Great. Thank you. Okay, our second Merit Award, which is an acknowledgement of individuals and/or teams who are making positive, sustainable changes across Health PEI's health system in the area of quality and safety, goes to the OBS-GYN Clinic at the Mount. At the time of the nomination, the team, led by Jan Skeffington, included a multidisciplinary group of medical assistants, LPNs, and physicians. Together, this group represented the largest specialty services clinic to adopt the new electronic medical record system, moving them away from paper charts and files, which in turn enabled them to develop a clear understanding of wait times, create targets, and develop workflows along with process improvements to ensure that cases could be triaged more effectively, as well as to ensure that the highest level of urgent cases could be seen within the targeted wait times. In brief, by embracing this system, there was a noticeable enhancement in ensuring that referrals were managed effectively and that there was a standardizing triage of the referrals process for the population of gynecology patients. On behalf of the Quality and Patient Safety Committee, we would like to acknowledge the key role your team played in the success of this initiative. Please join me on behalf of Health PEI Board in congratulating the members of the OBS/GYN team at the Mount on receiving an Award of Merit in Leadership Excellence in Quality and Safety. Accepting the award on behalf of the team are Dr. Krista Castle, Amy Mosher, Laura Ricks, Pam Ramsey-McLeod, Lindsay Maxworth, Jan Skeffington, and Sandra Gallbeck. Thank you. So this concludes the presentation of the Leadership Awards for Quality and Patient Safety for 2024. So on behalf of Health PEI Board, I want to extend congratulations to all the 2024 nominees and winners.
Thank you, Bill, and your committee. Such an important recognition program, which is showcased annually at this meeting. So it's now time for our second video tonight, and we want to highlight, of course, a major achievement of this year, and that is the signing of the Physician Services Agreement between Health PEI, the Government of PEI, and the Medical Society of PEI. This historic 5-year Physician Services Agreement is a valuable part of the strategy to increase the number of physicians practicing on PEI and ensure our system is set to support them. Some key highlights include recognizing family medicine as a specialty, making PEI physicians among the top paid in the country, introducing incentives for high patient loads, increasing compensation for all specialists, and reducing administrative burdens. In this video, we will hear from one of our own physicians, Dr. Megan Armstrong.
My name is Dr. Megan Armstrong. I work in PEI at a collaborative team-based patient medical home. I provide outpatient care and inpatient services at our local tertiary hospital. I've been working in PEI for 10 years now. So a real strength in PEI when it comes to remuneration is that we have the salaried option, which a lot of places don't have. And what that does is it lets me focus on the part of the job that I feel like is most important. I don't have an interest in being a business owner. I want to come to work and be a doctor. And so I can get up in the morning and I can come to work and I can focus on my team and I can focus on my patients, and I don't have to worry about those pieces of the puzzle that I don't think improve patient care. The new agreement and the improvement in our salary and some of the barriers from an administrative point of view that it's taken away, I feel like it really sort of accelerates that benefit. At the end of the day, we all get into medicine to help people, and if for some reason you feel like that's not the goal you're achieving, it's usually a system problem, not a you problem or not an individual problem. And the difference in PEI is they've given us the tools that we can put the pieces of the puzzle together where we feel like we're breaking through, the patient feels like they're heard, and you can actually achieve that goal.
Well, a lot, yes, that deserves applause. A lot of time and commitment was put into negotiating that agreement, and this really sets Prince Edward Island apart when we're doing our recruitment efforts, and certainly in retention as well. So a very exciting agreement was signed this summer. So before we let you go, it is time in the evening to have our financial report presented, and please welcome Mr. Pat Ryan, Comptroller for Health PEI.
Thank you, Jennifer. It's very pleased to be here this evening to present to you the financial report for the 2023-24 fiscal year. Normally, this presentation is done by our Chief Financial Officer, but Lane Pino couldn't be with us this evening. So if we have some slides here, I'm happy to report that the Health PEI financial statements received what we call an unqualified audit opinion from the Auditor General this year. Us accountants like to call that a clean audit opinion, whereby the Auditor General has told us that the financial statements are materially correct and in accordance with public sector accounting standards. A full set of financial statements will be included in the annual report. If we can go to the next slide there, this next slide will summarize Health PEI's financial results. And we can also see this information in note 18 of the financial statements. There are two components to Health PEI's financial results: operating activities and capital activities. Under operating activities, you'll see that operational revenues are equal to our program and services expenses. Health PEI's annual provincial operating grant was lower than budgeted due to our operating expenditures being lower than planned. The variance between the operating budget and actual expenses, I'll explain in a couple of minutes. When we look at capital activities, the capital revenues less amortization and accretion expenses results in a net surplus of $7.44 million. So each year, Health PEI is granted a capital budget. Spending from this budget is recorded in the financial statements as capital asset additions, and it's offset by capital revenue, which is reflected in the statement of operations. Capital revenue is offset by the annual amortization expense. Health PEI spent $29.78 million on a capital budget of $51.61 million in 23-24. So Health PEI experienced some delays in the implementation of a number of capital projects during the year, such as the radiology information system, $1.2 million, a medication cart replacement project of $1.9 million, ventilation upgrades to the QEH, Surrey Hospital, Beech Grove Home, and Wedgwood Manor. That's a multi-year project scheduled to be completed in fiscal year 26-27, totaling $2.9 million. And also cooling system upgrades for various long-term care facilities scheduled to be completed in the current fiscal year, totaling $1.6 million. A number of our community health centers are progressing but did not advance as quickly as planned, totaling $16.3 million. All of those capital projects have continued to move forward in fiscal year 24-25. Most were delayed due to supply chain issues. During fiscal year 23-24, several capital projects were completed, including the Picture Archiving and Communication System, or PACS, Phase 2 of the QEH roof replacement, and the Community Health Center West in Alberton. On behalf of Health PEI, I would like to recognize that a significant portion of Health PEI's equipment purchases are as a result of the hard work of our dedicated foundations. We owe a big thank you to the foundations and their donors for their generous support. Funding from the foundations allowed Health PEI to purchase equipment such as ultrasound equipment, cobas testing equipment, beds, mattresses, scoping equipment, including gastroscopes, colonoscopes, bronchoscopes, bedside patient monitors, and other monitoring systems, med stations, simulator for maternal child care, and sterilizing equipment. This is not a full accounting of the extensive list of equipment the Foundation supports. It's actually just a fraction of that, but a highlight of some of the larger purchases made during the year. We also want to acknowledge that in addition to what was recorded in Health PEI's books in fiscal year 2023-24, our foundations have made significant commitments for the year that will be completed in the near future. Some of those examples include, for the Queen Elizabeth Hospital Foundation, a CT scanner for the QEH ER, a nuclear SPECT CT, and an ICU central patient monitor system. And for the PCH Foundation, cardiac ultrasound equipment for diagnostic imaging, bariatric stretchers for various areas, and a portable ultrasound machine for the Shores Clinic. Again, Health PEI thanks our hospital foundations across the island for their support during this year. Moving to the next slide there, we have a summary of significant contributors to the variance in these expenditures compared to budget. The audited actual operational expenditures for Health PEI were $10.3 million below budget, and were offset by operational and capital revenue for a net surplus of $18.2 million when compared to budget. This represents a variance from our net budget of approximately 2%. So when we look at the major variances from our budget, we have government-approved initiatives. So throughout the fiscal year, Health PEI had significant discussions with the Department of Health and Wellness and the Department of Finance to identify possible one-time investments that would help support our health organization as well as our population. These investments included grant funding for Hope Air to support out-of-province travel for medical appointments. It includes patient medical home fit-ups on the UPEI campus for $4 million, and the UPEI ADHD clinic, $1.5 million. For out-of-province health services, Health PEI continues to see expenditures trending up, closer to levels experienced prior to the COVID-19 pandemic. We see increased volumes for the QE2 and IWK hospitals in Nova Scotia, as well as health services provided in Ontario for addiction treatments. In addition, Health PEI provided a donation of $2 million to the IWK Foundation. When we look at grants to private nursing homes, there are increases reflecting a CPI increase on the existing contract. There's a one-time funding to support private nursing homes in acquiring equipment to support the implementation of the Inter-RAI assessment tool. And we had grants to support capital costs for private nursing homes in efforts to help them add long-term care beds to the system, totaling $600,000. We also had costs for additional testing supplies for COVID at the nursing homes. Health PEI experienced inflationary pressures throughout the organization in non-salary related expenses, increasing costs in medical and surgical supplies for surgeries. We had plant operation costs for steam and heat, particularly for QEH and PCH. There were increased contracted costs, such as costs associated with security enhancements across Health PEI facilities, increases to external testing costs to assist in addressing volume increases. We had increased food costs for hospitals and long-term care facilities, and equipment and supplies for new patient medical homes. Health PEI has seen increased costs for repairs and maintenance across various facilities, including QEH, PCH, and repairs to long-term care facilities at Beach Grove Home, Riverview Manor, Colville Manor, and the Margaret Stewart Ellis Home. Renovations to various clinics sites, including Summerside, Kensington, Montague, and Sloman Park occurred. And maintenance expenditures to keep Hillsborough Hospital in operation until the new mental health campus is complete also continue. Under pharmacist services, with the new pharmacy contract, we saw an increase in the number of clients accessing professional services through the drug program, and that's a 16% increase compared to the previous year. We also saw some savings or surplus accounts in our accounts for this year. In-province physicians are showing a surplus of over $12 million, and that's $6.7 million net of new investments. The surplus is comprised primarily of vacancies in family medicine, psychiatry, dermatology, internal medicine, anesthesia, and nephrology. These vacancies were offset by the use of locum services across physician groups. And we had savings due to provincial pharmacy rebates. Health PEI is able to invoice for rebates based on the product listing agreement with the various drug companies. Health PEI doesn't budget for this rebate, and just to note that effective in April 2024, the provincial pharmacare program's budget was transferred to the Department of Health and Wellness, so we won't see those savings at Health PEI for next year. We also had some delays, savings due to investment delays and vacancies throughout our system. In fiscal year 23-24, Health PEI experienced vacancies in key areas, including RN staff, nurse practitioners, physiotherapists, LPNs, social workers, psychologists. These challenges have also contributed toward delays in the implementation of new investments and increased hours for existing staff who are making up for vacancies across the system. These shortages result in an increased reliance on other staff to maintain services in response to vacancies. Increased overtime for existing staff provides a partial offset for those temporary savings. In addition, Health PEI continued with shift incentives for nursing staff and memorandums of agreement to accommodate incentives for our collective agreements in the PEINU, OPSI, and IOE collective agreements. The estimated cost of these incentives was $7.4 million. And as well, Health PEI has utilized travel nurses to assist with covering vacant shifts. These costs are netted against the vacancy costs noted in our variances. On the revenue side, the Workers' Compensation Board in 2023 announced rebates that would be issued to all PEI employers. So a payment of $4.1 million was received by Health PEI from the WCB in late 2023. And that was recorded as revenue. Under capital revenue, as a result of a year-end review of our capital asset retirement obligation, that's a new accounting standard that we came under, Health PEI recorded an adjustment of $3.1 million to reduce the liability on our statement of financial position. So another way of looking at Health PEI expenditures can be found on note 21 of the financial statements, expenditure by type, which shows expenditure categories as defined by the standards of the Canadian Institute for Health Information. Compensation or salary cost is approximately 64% of our total healthcare spend. That pays our staff and our physicians who work in the system. We have sundry expenses, including operating grants to non-government organizations, public drug program subsidies, and grants established under union collective agreements. So significant grants that we paid during the year included public drug programs of $45.1 million and payments to private nursing homes of $47.1 million. We have contracted out services, approximately $58 million, or 56% of our contracted out services, represents out-of-province health services, which included over 15,000 inpatient days stay and 19,000 outpatient services provided to PEI residents when they're out of province. And under the supplies area, Health PEI spends a significant amount on supplies. Key items within the supply category include medical and surgical supplies, $25 million, plant operation and maintenance, $17 million, drugs, $24.5 million, lab supplies, $13.4 million, and food, $8.1 million. So I would like to thank you for having me here this evening, and also thank you to my colleagues with Health PEI staff for their dedicated service to support healthcare for all Islanders. And thank you also to the Health PEI Board, who continue to work with us to provide meaningful strategic leadership. Thank you.
Thank you, Pat, for that very detailed report. We appreciate that. So that concludes the reporting part of our agenda tonight. At this point in the evening, we will open the floor to questions that can be directed at the minister, our board chair, or our CEO. We have 2 microphones set up at the back of the room. If anyone has questions, please introduce yourself and pose your question. Our first question, go ahead.
Hi, my name is Trilby Jeeves, and my mom is in long-term care in Beach Grove Home. I've been involved with long-term care homes since 2011, so I've been witness to a lot, and I've advocated a lot for my mom and for other residents. And the job continues, and the question I have is regarding you talk about patient safety often, and I have serious concerns about patient mental safety. It seems to me that we discuss frequently about body safety. We keep the body safe. We talk about their ulcers, we talk about their falls, we talk about their medicine, but we don't talk about their soul and their mental health. And recently we went to lockdown again. And I have friends in another home as well, because when you travel these places, you make friends with other residents. And then other residents, these residents are coming to me as well because they feel safe to talk with me. And I have staff talking with me as well. And the frustration is around mental health. Why can't I get out? I'm not sick. Why can't I go to the mall? The staff can, but why can't I? Why am I a prisoner here? These are the things I keep hearing. So I want to know what it is and who is deciding that these lockdowns happen, and especially when there's only 1 or 2 people sick, and how can we change this, please?
I want to thank you for the question, and I want to start by saying that I really empathize with you. Throughout the pandemic, my mom was in a long-term care home, and it is a real struggle, the balance of safety and what safety means in a system. And I'm going to go back to the comments I made in my board report. When we think about the decision-making that we as system leaders have to make, we do have to take into consideration those 5 aims that I talk about, that balance, the lens of what it means for providers, what it means for the patient, what it means for the system as a whole, and are we looking through things from a health equity lens. So I think you're absolutely right. We need to be thoughtful about our elderly and our vulnerable in our long-term care homes. When we think about safety, when we think about patient outcomes, we have to think about it in terms of care and compassion and comfort and what they want for their health outcomes. These aren't institutions that they're committed to. These are their homes, and I think you raise a very good point. And I would say that the system can do a better job of balancing both mental health and physical health, and I think your advocacy is definitely warranted, and I appreciate your feedback. And with respect to your own situation, I would love to hear more about, the thoughts and opportunities where we can improve the care and compassion that we're providing to residents, while still finding the balance of creating an environment that protects the safety of those who are also very vulnerable and the safety of those that work in the system. And I think that is the challenging conversation and the challenges that we have to navigate. But I think our commitment to continue to look through that frame and making those decisions in and against a framework that does an appropriate job of articulating the needs of all is what we're committed to.
Thank you. I just want to, if I can, just put in sort of parentheses, the idea of strategic risk-taking. All of us in this room, we take risks every day to do our lives, and we also take risks that enable us to enjoy things. We get on a plane, and that's a risk. We go somewhere where we might get sick, but we take that risk. Maybe we buy some insurance. Driving here today is a risk, but I chose to do that. And I still think the people who are in these facilities, those who are lucid enough, should be have the opportunity to make that decision, to take that risk. And also just to note that it's not just the elderly that are in there anymore. We have a demographic that's changing. It's getting lower and lower. I'm witnessing that in my long time here with Mom and my dad, who's no longer here. I'm seeing younger and younger people in these places as well. And they're lucid enough to make some good decisions. Thank you.
Thank you.
Thank you. Any other questions from the floor? we did have a couple of questions that were submitted in advance of tonight's meeting, so perhaps I will ask Everton to present those.
No problem. Can you hear me here? So the first question is around, we've certainly heard about difficult challenges with both our patients and healthcare providers over the past several years. Does Health PI have plans to strengthen and engage with community groups and NGOs for increased wellness of our communities? This might be as simple as actively inviting groups that serve concurrent populations to come in and educate staff about the role of the community. And that question is from Susanna Rutherford, a casual LPN.
Great, I'll take that. Yeah. Thanks, Everton. Usually Everton helps me answer questions, so it's you're probably having fun putting me on the spot. This is great. But I love this question, and it is an important part of planning our healthcare services. And you can talk about the role of community agencies and NGOs in many different parts of the system. I think one of the places where we're actively trying to advance our engagement and planning is around our patient medical homes and patient neighborhoods. We had a board meeting up in Mill River earlier this week or last week, where we heard about just, how adjacent some of these social services are to healthcare, and how sometimes the intervention from outside healthcare is actually what determines the health outcome. And so as we plan our patient medical homes, it's incredibly important that we also plan for patient neighborhoods. And those neighborhoods should network and engage these NGOs and social services in providing some of those supports that are critical to the health outcomes that I spoke to earlier. And so that could be everything from Meals on Wheels, it could be services to clear driveways, and it could be, services that put bars on the walls in people's households so that they can continue to live at home independently. So we're absolutely committed to that. We do, as part of the planning that we talked about earlier, and I thank Megan for trying to articulate the work that they did over the 16 weeks, and she barely skimmed the surface. But when we talk about the provincial plans, the plans to develop operating models, to develop standardized services, what we're getting at there is the planning to be able to define what should be in a patient home, what should be in a patient neighborhood, how do we network those services that can exist across many communities, how do we recognize that some communities will require particular types of supports based on the needs and the data that we have on the populations there, and how are we using that information in our planning. This also came up at our standing committee meeting a couple of weeks ago when we talked about patient medical homes, and we heard loud and clear from a number of MLAs that the community groups want to be engaged more in the planning. So as part of the work plans that we've had the teams working on is to get out there and host more community meetings to be able to engage some of these groups more actively, so both they understand where we're going, but we can also benefit from understanding what they can offer and where they can offer it, so that we're maximizing the whole system. Did I do okay, Everton?
Yeah, I want to add to that too. I think we've recognized in the recruitment process that community engagement is so important. It's more than just a job, spousal employment, housing, childcare. So when these community foundations or groups organize themselves to support our new healthcare providers, it's very effective. And I know we have the community grants program where we've seen the community of Tyne Valley welcome physicians. There's an event in Crapo in the new year that they've organized to welcome some of their new providers within their community. So I think that's how we integrate our new providers into the community and tell them where their kids can go to school and what kind of types of activities. I've done it for Melanie since she's gotten here to help settle that family in Prince Edward Island.
Thank you very much.
There's a second question, Everton.
Yep, second question is, why did Health PI increase rates for existing long-term care patients by 24% in just 8 months? Why are increases random rather than annual? Why is Health PI unable to produce a written policy for families and spouses on long-term care rates? When and how much is the next increase? And this question comes from Ron McNeil.
Thanks, Everton. I'll take this one, and I've had the opportunity to correspond with Mr. McNeil about this previously. This predates me a little bit, but I have become familiar with this file where we have a policy of balancing the rates between publicly run long-term care homes and privately run long-term care homes who hold an agreement with the government. And what we do is once the agreements are negotiated, we balance out the rates so that from a public standpoint, it doesn't matter what home you're in, the rates are the same. I think what happened, and this happened in a number of areas where, you know, through COVID and over time, rates weren't increased as they normally would have, and then there was one large jump up, and I think the communication on that and the preparation for that large jump, that catch up, for lack of a better word, could have been better prepared. So that would be our commitment to Mr. McNeil, but also to the public, that as we're going through these negotiations with rates, and the rates for care will continue to grow as the rates for everything do, that we're more transparent again, as I talked about earlier, and that we're communicating what the timelines are for those, how those rates are set, and what people can expect so that people can more thoughtfully plan and prepare for those costs of providing care to their loved ones.
Thank you. Next question.
Just have a couple of questions there. Usually we have a copy of the annual report presented here at the meeting. Will we have paper copies distributed? This is the first time that we've never had a copy of the report provided.
Well, that's a good question. I'm sure we can arrange that. Barb, many of us know you, but perhaps just for the benefit of our viewers at home, if you could introduce yourself too.
Sorry, Barbara Brookins, President with the Prince Edward Island Nurses Union.
Thank you.
In a quick, I mean, again, unfortunately we didn't have Lane Pino with us this evening, who's actually lost both of his parents within probably 30 or 40 days. So I think from an omission part, not to make an excuse, but without Lane present, I think that would have been a duty that probably Lane would have, again, from the financial perspective, would have delivered.
Okay, I found it really hard to follow the financial report just because the slides weren't driving with the report. But I was looking and interested in a number that would identify how much money is actually being spent on agency nurses here on Prince Edward Island in the last year.
So thanks for the question, Barb. And I don't know if that number was specifically called out in those summary numbers, but I would be happy to have Pat follow up with you. Pat is our comptroller, and he's the gentleman who reviewed the numbers. And I too found it difficult to follow along. I don't know we had quite a lag on the slides. So I think Pat can follow up with you afterwards to provide that number.
Okay, I did enjoy the video, the second one especially, where you talked about the excitement over the progressive way we're dealing with the master agreement. I am looking forward to next year's video because the Nurses Union will be going to the table next year. And if you're going to be progressive, we're certainly going to be looking at being the top of the pack instead of the bottom of the pack when we're looking at recruiting. So thank you very much for the report.
Any further questions from the floor?
Hi, my name is Sean Amiot. I think it was the minister at the start of the session mentions that there was going to be 4 associate positions rolling out in the coming days. I was just curious, how long did it take to kind of find those 4 positions or associate positions, and do we have a queue or a backlog of more coming into the program?
Yeah, that's a great question. I share your impatience to this process. Again, the licensure part of this process does not reside within government, and it's with the college to, adequately verify qualifications of the associate physician program. We also require physicians to match in that particular specialty and to agree to that relationship. So that's another hurdle. So it has taken us a long time to get to the associate physician. It's exciting. I think it's a very strong opportunity to support our primary care providers, physicians, in giving them that AP support. So each situation is quite unique, to be quite honest. I do get calls about particular licensure challenges that we may have with some physicians from outside of Canada. So we do refer them to the college, and again, that's the first step, but I think they have found that process is quite onerous and time-consuming, but they continue to work on improving it.
Yeah, and I just might add that I think with the first 4 that we've recruited, we've learned a lot along the way, and I think through partnership and conversation with the college, we're understanding how to distill legislative requirements and regulation into documentation that, you know, your average person who's applying for a job can work and respond to. And so some of the work that our recruitment team is doing is looking at, you know, specializing, whether it's in locums, whether it's in particular types of nurses, whether it's in APs or PAs. How do we make that process to bring people from the time we connect with them to the time we onboard them into the workplace? How do we make that as streamlined as possible? How do we make that as customer friendly as possible, and not leave it to them to kind of try to interpret what does regulation mean in terms of the documentations that I need to provide, et cetera. And I would say going through it the first 4 times, you'll learn a lot along the way, and then you also learn you know, about, as I think the minister was alluding to, there's a lot of due diligence that needs to be done to ensure that the qualifications of the candidates that you're bringing in both match the requirements under the legislation, but also match the requirements that you're asking them to practice in, and the person that will be supervising them. So lots of learning, and I think we are hoping at this point we're going to pick up pace. It took a little while to get the first 2. The next 2 have come a little quicker, and so hopefully we're you know, we're on a bit of a path now.
Thank you.
All right, we have time for one final question.
Good evening. My name is Darcy Leggett. I am a proud nurse practitioner. I've been working on the island for about 5 years now. I want to congratulate the physicians on their new master agreement. We've heard a lot about them this evening. We haven't heard much about the nurse practitioners and the amount of time and effort that they do put into primary care. I've been doing quite a bit of literature reviews over the past couple of months with regarding to implementing nurse practitioners into primary care. After looking at the new physician service agreement, our compensation is still extremely underwhelming, considering that the majority of us take on full family practices now, actively taking people off the registry, and we are completely independent clinicians. You know, the funding models that we use are extremely outdated for the amount of responsibilities we carry, and I'm really excited to see what happens when we go to the table with our next collective agreement. Not only, you know, is our compensation underwhelming, it's patchy, especially with recruitment incentives and also retention incentives. So, I mean, there's always time to have conversations before we get to the table, but I'll leave that into the hands of the people who are going to be involved in that. Thank you.
Thank you for your comments, and I do appreciate them. And I do want you to know that, you know, as we were looking at the physician services agreement, and that as we were having conversations with the Med Society about that, and particularly with respect to family medicine and panel policy, we were also very mindful of the role that nurse practitioners play on our primary care teams, and that nurse practitioners do in many cases carry a large panel of patients. As we're planning through our provincial plans for the patient medical homes, our recruitment plans not only flag the providers that we need for patient medical homes in terms of family physicians, but also NPs as providers, and then of course all of the nursing staff, LPNs and others that go along with it. So certainly a area that we are focused on. We have had some conversations with your union about the role that MPs play in carrying panels. And I do think we look forward to working with them and working with you as we get to the table to find the right agreement that recognizes the role that nurse practitioners and nurses play, the important role that they play in healthcare. And I will say that I'm optimistic that we're going to have good conversations. We did something really remarkable here in PEI with the physicians. The agreement, the negotiations were based in trust. It was a very different process, something I've never seen before. And we were able to accomplish, I think, an agreement that did so many things for so many, but it required us to be at the table as trusted partners, putting patients and people at the center of each of our decisions. And as I said before, Barb and I are good partners, and I think when it comes time for us to get to the table, we're going to have those conversations as well.
All right, to ensure that you all come back next year, we will keep things on schedule tonight, and it is that time in the evening to wrap things up. For any of you who want any follow-up information, I think we have a few things to follow up on, and certainly any of the presenters will provide additional information. Our head table will be here to take questions also if you want to pose those one-on-one after we conclude our formal agenda. So we really thank you for your participation. We are very appreciative of your interest. As always, we look forward to engaging with the public, our partners, stakeholders, and of course our Health PEI staff in the previous months and of course in the future months to come. So we're all looking forward to a very productive year ahead. Thank you for coming and safe drive home.